Good morning, everyone. Can you see the PowerPoint all right? You can see that? Yeah? Okay, great. Well, today we thought we'd just talk a little bit about, you always hear me say taking a systems approach to treatment and thinking about how culture and diversity come into play. Um, you all will receive a copy of the PowerPoint following the echo today so that you'll have this information because we're going to go through some parts pretty quickly. But, as we all know, there are a range of identities, individuals who, are really underserved. And these can come in all different, for all different reasons: race, ethnicity, culture, developmental stage, faith, sexual orientation, gender identity. And so today we're going to talk primarily about culture. And so just so we're all on the same page about culture, is really learned. It's generational, transmitted through the generations, but it's a system of knowledge, concepts, rules, practices that we follow that are learned. Things like our language, our religion, our family structure, our legal system. But all of these things influence how individuals and their family system, their belief systems, their values, their behaviors, and also how receptive they are to mental health treatment, their beliefs and thoughts about mental health. These identities or the role of culture can really be pretty dynamic. So they're pretty fluid and they can change over time. Things can be added in, things can be lost throughout the generations, learned and unlearned. So understanding the cultural context of the individuals with whom we work, and as well as the system that surrounds them, understanding their experiences within this cultural context when it comes to their mental health journey is really pivotal for both assessment and ongoing treatment. We know that language, cultural differences, all of these things can impact our work with culturally diverse individuals or individuals who are outside a culture with which we identify. So it's critical that we really engage in this process of cultural humility. And so what do I mean when I say that? And that's really just this awareness and openness to different lived experiences and understanding how it shapes those individuals, inequalities that may be present in their past experiences or current experiences, and the assumptions we make about our world, about their world. And so you'll see some slides scattered throughout the PowerPoint. And it really is just sort of a self-reflective opportunity, things to think about in your own practice. So ways that we can engage in cultural humility. What diverse cultures do you have the opportunity to work with most often? Things to think about. So what can we as providers do within this cultural systems perspective? So really considering differences in attitudes and values and the impact that has on the individuals with whom we work when you're thinking from a systems perspective that's influenced by their culture. How we tailor our treatment approach, how we tailor our materials that we provide to them. Understanding the lived experience and potential stigma that might arise when they present for mental health treatment. How to discuss confidentiality and how that fits in with their cultural system and with their larger family system. Some it's practice for everybody in the family to have an open sharing about what's going in. For others, it's very, very private. How we might be able to use telehealth or interpreters to facilitate our work. The duration of our sessions, how we're providing materials. We also need to be considering how to build a strong rapport with that individual and their larger family system. And to do this, really taking into consideration their cultural background. And these include things that we talk about often in this echo: roles and expectations within that family system. What are their norms within that family system, structures within the family? What are their values and beliefs? You've heard me talk about this before. If we're making recommendations about treatment, say, for example, medication, and this goes against a belief system of the larger family system, this can really pit the treatment team against those individuals or that family system. And so knowing what their belief systems are before we make recommendations so we can find some shared common ground is really key so that we don't fracture any relationships or potential relationships and rapport we have with the larger family system. Understanding, religion, spiritual beliefs, levels of acculturation, and how that may differ within the same family system, and then their social norms. and building this into our treatment plan. So again, more considerations, what are some practices or techniques or strategies that you've used in the past to engage your many diverse clients that you work with? What's worked well, what maybe didn't work so well? And how are you finding opportunities to kind of build in cultural diversity, values, beliefs within your current practice? And how are you folding family systems into your work? So it is really critical that we take a systems approach to care, that we're thinking about each individual and each case from a systems framework, but also understanding and sharing with the individual and their family system that this is our approach to treatment, and explaining why this is so important. But we really need to take a good look at the needs of the individual and of their system, and see where the needs align and where they might differ. And always, obviously, with an eye to culturally respected behavior, and then working with that individual and system to become more effective in their home environment. So helping them understand that this is why we take a systems approach to care. So timing is really everything, and finding those moments to pull, loved ones, family systems in. And these are just some different opportunities, but there are many, many more that you'd be able to think of. For engaging a family system, and then moments as you build that rapport to really talk about belief systems, cultural values, things like that. So other self-reflective questions, thinking about how the individual system and culture is impacting their lives and their treatment, but also how that individual is impacting the rest of the system, and how their illness experience is impacting the rest of the system. I think another thing to really consider is what we can do to improve equity amongst the many diverse individuals with whom we work and have the opportunity to work. So considering the cultural context during your initial assessments and ongoing treatment. One of the things that I think is really, really important when you're working with an individual who has any kind of psychosis experience, is this experience culturally normative? Are these quote unquote unusual beliefs shared by their family members or by their family system? What sense does the family system make of it? Do they maybe have a shared belief around, if it's a spiritual belief, but they recognize that this individual, their interpretation is different, or it's causing them to behave in ways that are different than the rest of the family system? Those are really important pieces of information that we want to try to get as early as possible, because we don't want to over pathologize what somebody might believe, but we also need the information so that we can address it accordingly. What do the loved ones believe have led to the current illness experience, or the experience with these unusual beliefs, or what we would identify as unusual? And how does this deviate from their cultural norm? Is it happening more frequent? Is it lasting longer? Is it more intense? Is it causing them distress? And they recognize that, even though this is rooted in what the family's belief system may be, they're recognizing that it's causing some level of distress in this individual. And so gathering this information from the family system, and even from community members, if they have a close relationship with a church leader and the individual is open to you engaging with them, that can be a really useful information for us to gather. Considering our cultural background as providers and how this might impact our assessment, and understanding that there are these implicit biases, and understanding that there are diagnostic biases in our work. And so being aware of that, and really making sure that we always take a critical eye to our approach and what our thoughts are about each individual with whom we're working. And then really making sure to individualize care. So we have ideas and we have generalities, and making sure that we really identify individualized interventions that are relevant to this individual family systems experience and to the individual. We also want to be sure we're considering the individual and their loved ones' faith, spirituality, beliefs, how they cope. I think there's a misunderstanding at times that it either has to be you have a faith or a faith-based approach to whatever it is the experience is, or you seek mental health treatment, when really these strong beliefs or spiritual beliefs can really be a strength that can help to facilitate treatment. And so helping the individual, the loved ones, and even potentially their community or their faith leaders understand how we can walk hand in hand mental health treatment with spiritual or religious belief systems, because I think that that's not always known. But we do know that many people, their first sort of line of help or assistance seeking is really going to the faith leaders. And so how do we work with our communities and let them know that, you know, if somebody seeks mental health treatment, this can actually work well with what they're talking about in most cases and with their approach. Think about relevant sociocultural factors that can be misconstrued as symptoms or that might worsen symptoms. And so talking about the context of those experiences, like we mentioned, to avoid over-pathologizing. And so this enables us to really target the consequences of their experiences. So if they've experienced any kind of trauma, discrimination, struggles with acculturation, differences of levels of acculturation within the same family unit. We also want to be sure that we're not assuming that we know the culture with whom one identifies or how they, you know, their identity experience. And so we have individuals who might identify with multiple groups, and those multiple groups may all experience a level of oppression. And so, you know, how those cumulative effects of cultural experiences and cultural oppression are impacting that individual and their mental health. And being prepared to try to adapt our work as much as needed to involve the family system if the family system plays an important part in this individual's life. Sometimes we have to figure out and find ways to incorporate their cultural beliefs, their values, their needs and preferences, and figuring out how those align with our individual client. Where can we find some ways to meet in the middle? As much as we can, offering telehealth to increase accessibility, engaging in collaborative community stakeholder meetings, like we mentioned, and, you know, always trying to work from this competent and culturally aware and culturally humble place. So there were just a couple of tools I just wanted to remind us that are available and out there to help facilitate both the assessment and ongoing treatment when you're involving a family system from a culturally diverse perspective. So in the DSM, in the DSM-5, there's this cultural formulation interview. It's on pages 749 to 759. It is pretty dense, but you can always take pieces of it. And I think that's the most important thing. You know, I've gone through and I've picked my favorite questions, and it's for an individual, but how can I incorporate loved ones when I use this tool? How can I reframe the questions to ask of the system? To get their thoughts, but it really can help with assessing culturally diverse individuals to help us figure out, you know, diagnosis and treatment planning. And so it's got these various categories about identity, conceptualization of distress, psychosocial factors, the relationship between the individual, the provider, and I always say, and of the system. So when you're working on that section, think about it from that perspective, and then the overall cultural assessment. And they actually do have two versions of this. And so, you know, you'll see what brings you here today. Some people have different ways of describing the problem to their family or friends. How would you describe it to them? You can ask the same question of the loved one. How do they interpret what is going on? What troubles them about the problem? So it's a really useful interview, even if it feels a little bit dense at first. You know, pick out your favorite parts, because it can help with facilitate both the assessment and engagement of loved ones. And you all have heard us talk about the culturally informed therapy for schizophrenia, the CITS, a number of times. And I just wanted to highlight, you know, handout 2 is a great one that talks about, you know, family roles, how people are viewing their role within the family, who contributes what to this family system, how satisfied are they? So this is a great one to use with anybody, but especially culturally diverse systems, because it helps us really understand how their system works and how we might be able to fit into that larger system. And the other handouts that are pretty good are handout 6 and 7 that talk about the role of religion and or spirituality and how that impacts their lives. So I'm not going to go through all the questions, but I just put them here so you had ease of access. So really moving forward, some food for thought, thinking about how to engage in discussions about culture, values, belief systems with the individual and the family as soon as possible in the treatment process, and ensuring that this is part of an ongoing conversation. Continue engaging systems from that place of cultural humility, discussing aspects of diversity with individuals and their loved ones, knowing that we can't always see what culture or belief systems that individuals are a part of or that they ascribe to. And so really trying to pull that information from them as they're willing to share. Obviously, we want to ensure active information sharing loop amongst, all providers that are working within your system at your organization. And then considering use of those kinds of structured tools. We gave you 2 examples today, but in facilitating your conversations and your work around diversity and equity. So those were the highlights that I had for today. I will go ahead and pause in case there are any questions.